High blood pressure. In the United States, it affects approximately 75 million Americans. High blood pressure puts you at risk for stroke, heart disease, and a variety of other factors. For most people, they can successfully treat their high blood pressure with 3 to 5 medications and a change in lifestyle. However, there's a subset of the population that has high blood pressure that doesn't respond well to medication or lifestyle changes. Those are people with chronic high blood pressure, and if they don't get under control, they're putting themselves at risk for lots of different diseases.
Now, people who have resistant hypertension have an alternative procedure called renal denervation. And that procedure will require an insertion of a catheter through the femoral artery up into the renal artery, and they will use that catheter to ablate the nerves along the renal artery, and essentially that will reduce the sympathetic nerve activity, and that will reduce the blood pressure.
Now, the problem with renal denervation is that there's no way to quantify when the procedure has fully been completed. So the patient will go through the procedure, and then when they come back for the 6-month checkup, their blood pressure levels may or may not have gone down, and that's when the physician can decide, well, you know, the procedure probably didn't work, or maybe we need to try something different.
So this is where our product comes in. We are looking to send a signal to the nerve and measure its response. Analyze its response. If it changed significantly or it wasn't detected, it means that the procedure was performed successfully. This is useful because we're all different, so the magnitude of ablations for one person is not the same as the magnitude of ablation for another one.
The renal artery is 5 to 8 millimeters in diameter, so we're working on a really small scale, which has posed some problems in our manufacturing workflow. It's really difficult to work with our materials at that scale, and often certain machinery is required that we don't have access to, and our materials themselves are quite expensive. So at this point we've run a lot of tests, and we've shown that we can move our electrodes close enough together and still get out action potential. So we're confident in the science, and we're confident that we found the correct materials to implement our product. And at this point we're just trying to decide what's the best way to design.
This product has the potential to have a huge impact on the treatment of high blood pressure, and as a result can change people's lives for the better.